Uneven Progress in Gender Equality at Plastic Surgery Conferences, Lessons from a Decade of Meetings. In this article, the authors examine the speakers invited to participate at a number of national and regional plastic surgery conferences and ask the question of whether or not this speaker population reflects the evolving demographics of plastic surgery and of medicine as a whole. 2019 marked the first time that the majority of medical school graduates in the United States were female, and we have seen a similar upward trend in the number of women entering plastic surgery as a profession. Now, a number of previous studies have looked at the disparity between these increasing trends and the relative lack of female representation within leadership roles in plastic surgery. And it's really beyond the scope of this conversation to dive into the details of that question. But I do think that this is a really important framework for understanding the current article, because the authors really want to look at a snapshot in time. Things like leadership positions can be reflective of long-term progress, long-term changes, but speaker invitations happen on a year-to-year basis. So who is it that we consider a thought leader, an innovator, an expert in plastic surgery, and invite to speak at our conferences? Who are the people that are representing us to our colleagues, to our friends, to our mentors? Now, Table 2 shows the gender distribution of speakers at plastic surgery conferences in 2017 and 2018, and shows us that 80 to 90% of these speakers were male. Now, quite frankly, I was surprised by these numbers, and I was surprised that I was surprised by the numbers. I am someone who has thought a lot about gender inequality and implicit gender bias. I have thought about it, read about it, written about it, and still I found these numbers quite surprising. And I think that is the whole key to understanding implicit bias, is that even when we are aware of something, sometimes we have blinders on and we don't notice the actual manifestation of that bias, even when it's right in front of us, even when the speakers at our conferences are 80 to 90% male. When that's certainly not reflective of my experience as a female plastic surgeon. I have a really rich community of female colleagues, collaborators, and mentors that I rely upon. And I think of conferences in particular as a place where we all get together to learn and grow as a community. And so I think this is the importance of articles like this, is to highlight our blind spots to us and show us ways that we can make actionable changes to move forward to a more equitable future. So the authors of this article suggest that we do away with the informal networking that often results in invitations to speak at conferences, because informal networking is often a way that we perpetuate implicit bias. And they suggest that we develop more diverse and inclusive societies and specifically focus on diverse speaker populations for our conferences in a really thoughtful and calculated manner. They also want us to develop plans to address gender inequality within our training programs and our practice environments, and I really couldn't agree with them more on this front. You know, it's a challenge for all of us, but plastic surgery is a field of innovators, and if we put our minds to it, I certainly think we are capable of moving towards a more inclusive and more equitable future for all plastic surgeons, and I'm really excited for that future.